Hi, everybody. I am a clinical psychologist, and I meet with clients to identify psychological and emotional behavioral issues, diagnose psychological and emotional behavioral disorders. We teach classes, conduct research, develop and implement treatment plans and therapeutic processes. I help client define goals and plans action to achieve personal, social, educational, and vocational development and adjustment. I also publish research findings in industry journals. Today I want to talk about what Lewy bodies is. And Lewy bodies are misfolded proteins deposits in the brain. So Lewy bodies is a term for two related diagnoses. Refers to both Parkinson's disease and dementia with Lewy bodies. The earlier symptoms of these two diseases differ but reflect the same underlying biological changes in the brain. So some individuals will start out with memory or cognitive disorder that may resemble Alzheimer's disease, but over time, two or more distinctive features become apparent, leading to the diagnosis of dementia with Lewy bodies. Symptoms that differentiate it from Alzheimer's, including unpredictable levels of cognitive ability, attention or alertness, changes in the walking or movement, visual hallucinations, a sleep disorder called REM, sleep behavior disorder, in which people physically act out their dreams, and severe sensitivity to medication for hallucinations. In some cases, the sleep disorders can precede the dementia and order symptoms of Lewy bodies by decades. Others will start out with movement disorders leading to diagnosis of Parkinson's disease and later develop dementia by other symptoms common in the dementia Lewy body. Lastly, a small group will first present the neuropsychiatric symptoms, which can include hallucinations, behavioral problems, and difficulty with complex mental activities, leading to an initial diagnosis of dementia Lewy bodies. Regardless of the initial symptoms, over time, all three presentations of Lewy body dementia will develop very similar cognitive, physical, sleep, and behavioral features, all caused by the presence of Lewy bodies throughout the brain. And this can happen, and some symptoms may fluctuate often as a moment to moment, hour to hour, or day to day. Also, for treatments, there's medications, different medications for each. So movement, visual hallucination, sleep behaviors. There's different medications that they can take. In non-medical treatments, there is physical therapy, speech therapy, occupational therapy, individual and family psychotherapy, support groups. So basically, there's no cure or definite treatment for Lewy body dementias that has been discovered yet. The disease has an average duration of 5 to 7 years. It is possible for it to be from 2 to 20 years, depending on several factors, including the person's overall health, age, and severity of symptoms. Also, I would like to talk about how early and accurate diagnosis of Lewy bodies is essential. It is important because Lewy body patients may react to certain medications differently than Alzheimer's disease or Parkinson's disease patients, as a variety of groups, including anticholinergics and some anti-Parkinsonian medications, can worsen the Lewy body symptoms. Also, physicians' education is urgently needed. An increasing number of general practitioners, neurologists, and other medical professionals are beginning to learn to recognize and differentiate the symptoms of Lewy body dementia. The most misdiagnosed dementia from other diseases. However, more education on the diagnosis and treatments of Lewy bodies is essential. More research is urgently needed as well. Research needs includes tools for early diagnoses such as screening questionnaires, markers, neuroimaging techniques, and more effective therapies. With further research, Lewy body dementia may ultimately be treated and prevented through early detection and neuroprotective interventions. Currently, there is no specific test to diagnose Lewy bodies. And my patient that I have now is a 55-year-old Caucasian man from a high socioeconomic status. He was initially misdiagnosed with major depression, and all the other signs were missed. So, poor motor skills, depression, hallucination, sleeping behaviors, so many other things. So he is now in medication, and also he is taking some non-medication treatments, so some physical therapy and occupational therapy. And also he gets together with me about twice a week, just to talk and to help him have a better life, everyday life, and to help him and his family how to go about his mental illness. Thank you so much.